Periodontics is a dental specialty involved in the diagnosis and treatment of diseases of the supporting tissue. Periodontal examination includes patients' medical and dental history, radiographic evaluation, examination of all the teeth, oral tissues, and supporting structures, and lastly, periodontal charting. Some early signs of periodontal disease would be bleeding gums, loose teeth or mobility, inflamed gingiva, abnormal contour of gingiva, periodontal pocket formation, malocclusion, halitosis, pain or tenderness, recession, and discoloration of the gums. Radiographs play a very crucial role in the diagnosis of periodontal disease and periodontal treatment, and the accuracy of them is critical because if there's any distortion, then there could be an incorrect diagnosis. And the bite wing radiograph is particularly valuable because it can actually depict the bone height along the root surface. The following are instruments commonly used in periodontal therapy. Chisel scaler is an instrument used to remove supragingival calculus in the contact area of anterior teeth. A curette is a surgical instrument used to remove tissue from a tooth socket. A file is a metal instrument of varying size and form with numerous ridges or teeth on its cutting surfaces. The furcation probe is used to measure horizontal and vertical pocket depths of multi-rooted teeth in furcation areas. The Gracie curette is a curette with one cutting edge. It is area specific and it is designed to adapt to specific tooth structures, either mesial or distal. The Hoe scaler is a type of scaler used to remove heavy supragingival calculus, and it is most effective when used on buccal and lingual surfaces of the posterior teeth. The Kirkland knife is a double-ended knife with kidney-shaped blades, commonly used in periodontal surgery. The laser is a highly concentrated beam of light. The Orban knife with a spear-like shape and cutting edges on both sides of the blade. It is commonly used to remove tissue from the interdental areas. The Periodontal Explorer is a fine, thin instrument that is easily adapted around root surfaces used to locate deposits of calculus. The periodontal probe is used to locate and measure the depth of periodontal pockets, and it is tapered to fit the gingiva sulcus with a blunt or rounded tip. A periotome is an instrument used to cut periodontal ligaments for atraumatic tooth extraction. A sickle scaler is a hook-shaped instrument that is available in various sizes and shapes and is used for the removal of tenacious supragingival deposits of calculus. Ultrasonic scaler is a device used for rapid calculus removal. It operates on high-frequency sound waves. A universal curette is a hand instrument used to calculus. The ultrasonic scaler is a device used for rapid calculus removal. It operates on high-frequency sound waves. The universal curette is a hand instrument used to treat subgingival surfaces. It has a blade with an unbroken cutting edge that curves around the toe and a flat set at 90-degree angle to the lower shank. Ultrasonic and manual scaling techniques produce equally good results in calculus and dental plaque removal. The ultrasonic scaler provides rapid calculus removal and reduces hand fatigue for the operator. Newer styles and slimmer instrument tips have been designed to provide easier access to subgingival pockets. Some indications would be removal of the supragingival calculus and difficult stains, cleaning of furcation areas, removal of deposits before periodontal surgery, removal of orthodontic cements, or debonding. Some contraindications would be communicable diseases, patients susceptible to infection, respiratory problems, swallowing difficulty, and cardiac pacemaker. Not all periodontal diseases require surgery, so some non-surgical periodontal treatment would be dental prophylaxis. It is a procedure which involves the complete removal of calculus, soft deposits, plaque, and stain from all supragingival and unattached subgingival tooth surfaces. Scaling and root planing are done as a part of periodontal debridement and that means that it removes deposits on the tooth and will reduce the bioburden within the pocket. The gingival curette involves scraping or cleaning the gingival lining of the pocket with a sharp curette to remove the necrotic tissue from the pocket wall. Antimicrobial and antibiotic agents are also commonly used. The antibiotics have been used for the reduction of periodontal diseases, including the metronidazole and amoxicillin, either alone or in combination, as well as tetracycline, penicillin, fluoride, and chlorhexidine. Unfortunately, some types of periodontal disease do require surgery. And in that case, the purpose of crown lengthening is a surgical procedure that is designed to expose more tooth structure for the placement of a restoration, such as a crown. Soft tissue grafts, also commonly known as pedicle grafts, are used to move gingivae from an adjacent tooth or edentulous area to a recipient site on another tooth. The post-surgical patient instructions are as follows. You should limit your activity for the next couple days. Remember not to rinse your mouth for 24 hours. There will be some bleeding after. Just continue to bite down on gauze and apply pressure to allow the blood to clot. You will experience some discomfort, but there will be antibiotics and medication for that likely. Give yourself a soft diet. Foods like jello, soup, that sort of thing. A dressing material may be applied and it may chip off, but it will stay in there. Swelling is expected, and to remember to just ice on and off for 20 minutes. It is important that you do not smoke. Some indications for the placement of periodontic surgical dressing would be to hold the flaps in place to protect newly forming tissues, to minimize post-operative pain, infection, and hemorrhage, to protect the surgical site from trauma during eating and drinking, and to support mobile teeth during the healing process. Some types of periodontic plastic surgery would be crown lengthening, ridge augmentation, aesthetic surgical correction, coverage of denuded root surfaces, reconstruction of papilla, aesthetic correction around implants, surgical exposure of unerupted teeth for orthodontics, and periodontal prosthetic correction. A laser beam is a highly concentrated beam of light. The power of this beam can be adjusted to enable it to cut, vaporize, or cauterize tissue. Periodontal application of lasers on soft tissue include the removal of tumors and lesions, vaporization of excess tissue as in gingivoplasty, removal of or reduction in hyperplastic tissues, control of bleeding in vascular regions.